Purple Solutions to Fix Healthcare in America podcast. Each week, we explore bipartisan solutions to healthcare reform through discussions with leading experts from across the country. To learn more, go to purplesolutions.org and join us at our Healthcare Economics Summit on July 31st.
Hello, everybody. I'm Dan Sim, here again with the next installment of the Purple Solutions podcast. And I'm real excited because today we have David Balat, and David is director of the Right on Healthcare Initiative with the Texas Public Policy Foundation. And previously he was a healthcare executive. Most importantly to me, selfishly, is that he wrote a really wonderful chapter in the Purple Solutions book entitled Direct Care, Empowering Patients. And I'm hoping we can learn a little bit about what that means and why it's a good thing. So David, thanks so much for speaking right now and contributing to the book, and also for speaking at our Healthcare Summit on Friday. So thanks for being here.
Really appreciative for being asked and being able to contribute. It's an important topic, so I'm glad it's gotten the attention it has. And again, thank you for putting all of this together. I think it's important to bring all ideologies to the table, because I've often believed that we all want the same thing. Yeah. We have different approaches of how to get there. And that's what we need to come to an agreement upon is what are the best ways to get there.
Yeah, I think we're in such a polarized world right now. I wish people would sort of step away and just realize that on both sides of the aisle, what we want is better healthcare that's more affordable and more accessible. It's just we differ in how we think we get to that. And so let's talk about how we think we can get to that, or you think we can get to that. So, but before we get started, just to sort of set the stage for things, can you talk a little bit about your background? Because you have an interesting background. You were a healthcare executive, and now you're at a foundation thinking in terms of policy and things like that. So.
Big switch in my career. I originally got into the hospitals. I grew up in the hospitals. My first job was there at the age of 15, and worked there throughout college, working my way through school. And that's I had a love for that portion of healthcare where we got to take care of patients, and I worked closely with the doctors and the nurses. And so my schooling took me that route. I became a healthcare executive and a hospital administrator, and did that for nearly 20 years.
Okay. You got a pretty good sense of how the system works?
Yeah.
Doesn't work? Fortunately
and unfortunately.
Yes.
I truly believe that most people, I like to believe that all, but that's not necessarily the case, but most people that get into healthcare get into it because they feel connected to being caregivers. And even from my perspective as an administrator, I saw my role as being in a job that created an environment where healing could take place, empowering and providing resources to medical professionals that were trained to take care of patients, creating a safe environment and allowing patients to get the care that they needed. Yeah. I towards the end of my career, I just didn't feel that was the case anymore. Mm-hmm. Felt that I was contributing to the problem rather than being part of the solution, which is why I made the change and the switch that I did.
Okay, to Texas Public Policy Foundation. Yeah. And what is that about? Yeah.
Well, the Texas Public Policy Foundation is a nonprofit, nonpartisan think tank in Texas, and I run the Right on Healthcare Initiative. We are advocating for and researching and educating on how it is that we can make healthcare affordable. Essentially, what we understand that healthcare is the relationship between doctor and patient. Mm-hmm. And the reason why healthcare has become so unaffordable, so inaccessible, and so inefficient is because there are so many middlemen now that have injected themselves between those two relationships.
Right.
So we look at ways to mitigate the presence and existence of middle and bringing both doctor and patient back, making it more affordable, accessible, and efficient.
Yeah. Yeah, I think, and it's kind of interesting, a lot of the discussion that I have with people, in this effort to write a book about purple solutions for healthcare reform is just going down that road of empowering at the front lines of healthcare, the patient and physician interface. It's not as though I intended to become an advocate for that. It just seems like having that happen is what gets you better healthcare. And that's probably why we have the current and former president of the AMA speaking as well. As I guess I've moved into that camp without knowing it. But let's get to sort of the main topic, which is what you wrote about, which is direct care. You know, what is direct care, and why is it a good thing? So,
Care is it really it dovetails well with what we just talked about. It's creating that relationship, eliminating all of the nuisances and obstacles. I think many of the patients or the people that are watching this, and we're all patients, noticed something over time if they're old enough to do so. There was a time when you went into a doctor's office and the doctor looked you in the eye, sat there and talked to you about what was going on. They put their hands on you and they tested you. And currently that's not the way it works anymore. Now, unfortunately, your doctor's in the corner with their back turned towards you and typing on an electronic billing record. And I'm very deliberate in the use of the word billing record because
I noticed.
the reason that all of those records are meticulous and maintained is so that billing can be done.
Yeah.
It's not really made healthcare better.
Right.
But the insurance middlemen, all of the other organizations that are seen and unseen that feed at the trough of that healthcare dollar have created that big separation and have created a distance between that medical professional and the people that go in for care. And really, we don't have a healthcare system in this country. We have a sick care system. It's reactive in nature. Everything is based on a code that represents some form of illness that they're there to take care of.
Yeah.
So direct care turns that on its head. Direct care is having not only a personal relationship, but a financial relationship with the medical professional. Direct primary care is a great example of that. And that's one of the things that we go into in the book.
It removes these kind of middlemen that are getting in the way of that patient-physician relationship and keeping it kind of simple. I mean, I'm a slightly older guy. I remember watching the show Marcus Welby. It's inspiring, or MASH, just things where you get to see physicians helping people and just having control over what they do. And in the system we have right now, I think physicians would agree that they don't feel like they have a lot of control. They're in kind of a machine.
Without question. And those that have made the move into direct primary care, which means that they've opted out of taking any type of third-party payment.
Yeah.
Many of them they're doing house calls.
Yeah.
They're talking about what's going on with the family. They're talking about there's a big conversation now about social determinants of health. One of my family member I introduced to a direct primary care doctor, her first visit was in her home, and he brought a nurse practitioner, and they checked out the house and made sure that everything was conducive for her conditions, and they developed a plan for how they were going to manage her chronic issues.
Mm-hmm. I think that's the way physicians would like to do things. They just don't have the time. They're not allowed to. Plus, the way they reimburse is based on the coding.
That's the key. Yeah, that's the key. Reimbursement and insurance drives healthcare today.
Yeah.
And something that if anybody ever here's another talk that I ever give, this is something that I say almost consistently, is we've got to stop conflating and confusing health insurance with healthcare. Yeah. When we hear politicians talk about healthcare, they're not really talking about healthcare. They're talking about health insurance.
Right.
And it's been a huge disservice to our delivery of healthcare.
Yeah, I wish there were a way to get to those politicians and to the people as well, because I think 90% of the time their intentions are good. They think they're getting better healthcare for people, but insurance isn't the best way to do that necessarily. Is it possible to function without insurance? I mean, I think people are afraid to do anything unless their
Well,
insurance allows it. So,
I don't advocate not having insurance. I think having insurance is a good thing. But
right,
what we have today is not insurance. What we have today is prepaid medical care.
right,
It covers everything comprehensively as opposed to just covering catastrophic care.
right.
Let me give you an example with prescriptions. When I had insurance, I had a $30 copay at the pharmacy. When I changed jobs and I didn't have insurance at the time and I was uncovered, I went to the cashier and I went to go pay, and I thought this was just going to be an astronomical amount of money for this medication I've had for years and years. It was under $10.
Yeah.
I had been triple paying with my copay for years. But if I paid cash, I was paying less than a third.
That's crazy. Yeah. I had the same thing with my children. So
But it's not uncommon.
Yeah.
And that's the case with seeing the doctor, seeing the specialist, getting surgery, dental care, you name it. Now, when really bad things happen, getting back to how this conversation started, cancer diagnosis, heart attack, stroke, something catastrophic, that's when insurance has its proper role.
Right. Yeah, that is sort of, I think, the right way to do it. And that is, not to put in a plug for the book, but that is what we talk about, which is...
Absolutely put in a plug for the book.
Okay, it's my podcast.
There you go.
But yeah, use insurance for catastrophic expensive things, because the more routine things are actually less expensive if you pay cash rather than using your insurance. And I think people have trouble believing that, or don't even know how to do that. So
we've been conditioned to think otherwise.
Yeah.
And it's again, part of our mission is to educate and inform.
Yeah. So I'm hoping people are listening and willing to take a chance. So you say direct care, I remember when I was talking to you about a title for the chapter, direct care, direct primary care. You chose direct care because it's more than just physicians and primary care, isn't it?
Absolutely is. It's physicians, primary care physicians, it's specialists, it's surgical centers, it's pharmacy, and it's dental care. And it can be so much more. And we're seeing that pendulum swing. It's becoming more and more prominent, and I'm thankful for that. We've seen really, as terrible as COVID has been, if there is a silver lining, and there have been a couple, people have, the unfortunate episode of them losing insurance, people have seen, you know what, if I do it this way, it's not as expensive as if I had insurance.
Right.
Now, we need to have some form of coverage, like I said, for catastrophic events, but people are putting more money back in their pocket by not having this insurance that we have today, or prepaid medical care that we have today.
Right, yeah. Well, with COVID, everybody's gotten used to using telehealth. And that is maybe $20, $50 for a session with your doctor. Whereas if you used your insurance at the hospital, it could be a lot more. So,
without question. And it's a good way of delivering care.
Yeah.
And with direct primary care, since we're talking about direct care, telemedicine is a regular occurrence. I personally use direct primary care, and I speak with my physician on the phone, via text, via a protected portal in their system, you name it, and it's at our discretion and how we're comfortable. But it's been nothing but a good experience for me and my family.
Yeah, I hope we can have more of that and people realize that's a good way to go. These direct care physicians, I understand the price can be maybe in the range of $70 to $100 a month, and you get 24/7 access.
Less than that. The range I've seen nationally is 60 to 80. Of course,
Really?
You're going to have folks that are lower or higher, but that's been the most consistent range. And for children, it's anywhere from 20 to 40.
Yeah. To get a doctor anytime you need them. I mean, that's
24/7 access. That's correct.
That's less than one emergency room visit.
Well, and then they replace the urgent care center.
Yeah, exactly.
And what ends up happening is the doctor becomes your navigator.
Yeah.
If you choose to. It's not like an HMO where you have to go through them. This person is your partner,
Yeah.
and they want to help you. They want to be proactive and look, be that quarterback for you
Yeah.
within this complex healthcare system.
That's a win-win. I think it gives you better care, and I think the doctors are happier doing that job. So
A lot of them, that's why they went to medical school.
yeah. So I don't know, do you have any examples of seeing this work well? I guess you talked a little bit about some of it in your own life. So
My personal experience has been great. I spoke with a direct primary care physician in Pennsylvania, and we were just having a conversation about some other topic, and she says, "I've got to call you back. I'm driving into one of my patients' homes. They're afraid to leave because of COVID, so I'm performing a visit at their house so that they can be comfortable."
yeah.
That's just one of the examples. Again, the access to a doctor. I do have one example. There was one direct primary care physician, and he always told his patients, he said, "Look, if you go to the ER, let me know ahead of time and tell me which ER you're going to." And they did so one particular instance when they were taking their daughter, and he said, "Which one is it?" They told him. He called ahead, spoke to the ER doctor, and said, "I'm the primary care physician for this patient. Let me know before you order any kind of test. Don't order any imaging or labs. I've just recently done those for this patient, so I can provide you with the information." Turns out that many of the tests that would have been ordered were not needed because the doctors were in communication with each other.
Wow.
So the bill, they took care of the young patient. It wasn't as astronomical as it could have been, although it was still expensive because of the opacity in the emergency rooms and the out-of-network situation that we have.
Yeah.
But doctor was able to still participate in the care of his patient, even though they were under the care of another physician at the time. They worked as a team, which is the way healthcare should be.
Yeah, that's a great example. And to have somebody who is your navigator, especially if we move to a situation where we're in control of our medical information and we can go where we want and have a navigator like a direct primary care physician help us through that. Right now, because it's so hard to move medical records, it's like a barrier to communication.
It is. It truly is.
Yeah.
This model really lessens that barrier, but it doesn't eliminate it, unfortunately. That's just more work that we have to do.
Yeah. So now I'm kind of leading up to the big question. So, we have an election year coming up, quite an unusual election year on like 10 different levels. COVID didn't help with any of that. So, what are you thinking that voters should know and be thinking about? And then maybe related to that, if you want to treat them as two separate answers, if you had Bill or Donald here, what would you want to tell them? I mean, I think that's kind of connected. So how do we get out of this mess?
Yeah. I think I mentioned earlier that there's a difference between health insurance and health care.
Yeah.
What we have is a trust in insurance and a trust in government, and those that trust those entities don't trust the other.
Yeah.
And they're both right for their distrust. They don't trust the government because they fear that the government will take over the healthcare system, and that may be a valid concern. And then there are those that trust the government and not insurance because they're not seeking the best interest of the patient, and it's just there's crony capitalism going on, and you know what? There's some truth to that too.
Right.
But a lot of that has to do with the fact that the patient doesn't have any control.
Mm-hmm.
Patients ultimately, it comes down to two things. Patients want to have control over their own care, and they want to be able to feel the peace of mind that they're not going to leave a financial burden for future generations.
Yeah.
And so it's important that we give power back to the patients. Why not give them tax advantaged dollars in a spending card like an HSA or an HFA? Let's have complete transparency so that when we do spend those dollars, we know what the price is up front. and not 3 months after the service has been rendered.
Right.
Let's, we've got a lot of regional monopolies in healthcare. Hospitals and many of the other companies, insurance companies and pharmacy benefit managers and third purchasing organizations, there's just been, over the last 10 years, a lot of consolidation. So there's less and less competition. And when you have less competition, you have higher prices.
Yeah.
So we need to look at, are there some antitrust issues going on so that we can promote more competition?
Yeah. No, I think that's a nice roadmap. I wish there was a good way to communicate that to people, but I think in the end, what you're describing is empowering patients and us as consumers. I don't know if there's a good advocacy group for that. So hopefully, if we can start to put power in the hands, sort of like Uber, people will choose what they want. They just have to realize that and want to be empowered.
And that, it's a good example. Uber, Netflix. Could anybody have envisioned that Blockbuster was going to go away and be a thing of the past?
Yeah.
I don't think so, because we all loved Blockbuster.
Right.
It was part of our weekly ritual. But Netflix came into being, Hulu, and all these other, they've changed an industry. And that's what I believe direct care can do for healthcare. This model, implemented as it's functioning today, can substantially transform the healthcare industry and contribute to empowering the patients like we've talked about.
Yeah, I totally agree. We need some disruptive innovators to put that power in the hands of patients so they can see that they can use it. And maybe there can be some kind of grassroots healthcare revolution. Let's make that happen.
That's our hope.
All right.
Hopefully,
Thanks, David.
Hopefully, we'll do a lot of that education through this book you've allowed us to be a part of.
Yes, and I'm honored and grateful that you contributed and a lot of other great contributors and talking about all of this at the summit, which we'll make available. So thanks for your partnership in all of this.
The honor's mine.